Thank you very much. In this presentation, I would like to share with you a few words about the work we have been doing at the University of Rwanda College of Education, mainly the development of a continuous professional development certificate for secondary school teachers in teaching and learning using music, dance, and drama. We may ask ourselves, why was this CPD developed? What was the question it is coming to answer to? Then I will share ideas about the process and the progress we have made so far. And I will also highlight key steps in this presentation. The CPD program in teaching and learning using music, dance, and drama comes to address a number of questions and allow me to highlight very quickly some of these problems. One, teacher-centered pedagogies. We observe that in high schools in Rwanda, in some schools, really learners are considered relatively as empty vessels to be filled with content knowledge. The second issue is the low involvement of learners in the teaching and learning process. Third, we also observe a lack of sustained teaching methodology to implement a competence-based curriculum, CBC, which was introduced in 2013 by the Rwanda Basic Education Board. So although the CBC was introduced since 2013, there was no robust tool to help teachers implement this competence-based curriculum, and therefore our CPD comes to fill this gap. Fourth, we also observe the low involvement of Another issue is the high level of dropout and repetition. Also, instances of physical violence infringed on learners in the form of corporal punishment, and sometimes conflicted with promoting discipline. And lastly, the CPD comes to address the issue of different forms of structural and cultural symbolic violence in the form of ideologies, beliefs, attitudes, and values, which might be at odds with the ideal of creating conditions allowing high school learners to bring the best out of themselves or actualize their potentials. These are the issues that the CPD comes to address. Now, how did we go about this development? How did the development of the CPD take place? First, we started by training a group of 15 lecturers from the University of Rwanda College of Education. I want to highlight here that the University of Rwanda College of Education is the public higher learning institution in charge of training secondary school teachers. So these 15 lecturers were trained in the mobile arts for peace methodology with a view to systematize the MAP manual in 12 units. And these 12 units were used, were described as how they can be used to teach the subject of music, dance, and drama in the Rwandan curriculum, because it has been shown that this subject of music, dance, and drama, as it is today, lacks seriously practical components, in other words, activities. Secondly, we proceeded with developing the CPD program, and we started by producing the program proposal, program structure, module description, teacher guide for the CPD to take shape. Next. The program proposal. We met as a group of URC lecturers to produce the program proposal for this CPD. The CPD in teaching and learning using music, dance, and drama. And when we refer to the program proposal, we are mainly alluding to the following elements: the program title, the exit award, the modes of delivery, mode of attendance, resource group, first year of delivery, program funding and administration, program background, rationale, and indicative content, as well as unit of approvals and resource confirmation. After developing the program proposal, we also produced the program specification. Next. In the program specification, we described the program aims and rationale, the why of the program. We also highlighted the attributes that the graduate from this CPD would emulate, and we also showed the program structure. Next. Thank you very much. Now, I want to show you how this CPD is structured. By devising this structure, we were inspired by the guidelines from the College of Education, specifically regulating the CPDs. Our CPD certificate for secondary school teachers in teaching and learning using music, dance, and drama comprises 2 modules, and each module is worth 10 credits. So in total, the CPD is worth 20 credits. The first module, we have given it a module called MDD 1141. MDD standing for Music, Dance, Drama. MDD 1141. And the title is Music and Dance-Based Teaching and Learning. And the second module is MDD 1142, Drama-Based Teaching and Learning. Next. After developing the structure, we now went into each and every module to produce the module description. In other words, the 2 modules were described in great details. And with the module description, here we are referring to the following elements: the module code, the module title, the year of presentation, the trimester, the credits, the first year of presentation administering school, the module type, whether it's a core module, elective, prerequisite modules, co-requisite module, prohibited combination. We also described the allocation of study and teaching hours. We also gave the brief description of aims and content, indicative content, learning and teaching strategy, assessment strategy and assessment pattern, strategy for feedback and student support during the module, as well as indicative resources. So each module has now been given a detailed module description alongside these lines. Next. Now, after developing the module description, we now thought of producing a teacher guide. It's a document that shows how a teacher who is, for instance, teaching mathematics can use music and dance, but also drama in teaching mathematics. Or a teacher teaching sciences can use these art forms to teach sciences. The same applies for social sciences and languages as well. So the teacher guide is a user-friendly, showing clearly how a lesson can be introduced, how the development of a lesson can be done, and how also the conclusion and evaluation of the lesson can be conducted using music, dance, and drama. I want to highlight that in this work, we have been working very, very closely with the Rwanda Art Council, especially the federations of music, dance, and drama. The idea here is actually to think of a paradigm, a teaching and learning paradigm, where a teacher works closely with an artist to prepare a lesson. The idea here is about decolonizing teaching and learning methodologies. It's a way of going against didactic, teacher-dominated approaches and give room for learner-centered pedagogies, where the learner is at the center of the learning and teaching process. It's also a way of decolonizing knowledge, because most of the time we consider knowledges from the global south as not worthy, not of value. This CPD is trying to suggest an idea that local indigenous cultural forms can be used as vehicles for communicating knowledge, as vehicles for unpacking knowledge. You know, most of the time we rely on categories. In teaching and learning, we rely on categories, symbols, you know, meanings constructed from the global north. This CPD is saying we want to use categories, symbols, paradigms from the global south, from local cultural forms, in order to transfer knowledge, so that learners can feel at ease with the content, so that learners can better understand what's going on in the teaching and learning process. Next. Now, another thing we have done is to develop model lesson plans. And we produced a number of model lesson plans as a way of helping teachers really to better use the methodology. We developed the 3 model lesson plans in English and literature. In other words, we showed how an English teacher can teach English subject or literature subject using music, dance, and drama. We picked 1 English lesson and 3 literature lessons, and we actually developed a model lesson plan showing how this can take place using music, dance, and drama drawn from the Rwanda local cultural context. We also produced 2 model lesson plans in history, 2 model lesson plans in Kinyarwanda, 1 model lesson plan in biology, 1 model lesson plan in mathematics, but also a model lesson plan in chemistry and 1 model lesson plan in physics. Next. Now, I'm concluding by showing various steps that have to be undertaken in the near future. Very shortly, we are envisaging to conduct a piloting of the CPD with 10 teachers in Kicukiro. In other words, we want to invite 10 teachers from Kicukiro district and then start piloting this CPD with them. These teachers will be those teaching mathematics, sciences, languages, and social sciences as a way of getting a feedback vis-a-vis our CPD. And in the final phase, we will present the CPD to the Department of Foundations, Management and Curriculum Studies at the University of Rwanda College of Education. This is a requirement for the validation process of a CPD, starting from the department, then to the school, and finally to the College Academic Council, where we'll get the final approval. In concluding, I want to say that in this project, we are working very closely with the Rwanda Basic Education Board, which is on board, and which has been also involved heavily since the development of the CPD until now. And the Rwanda Basic Education Board is badly waiting for this CPD because upon its approval by the College of Education, it will start running throughout the country by training secondary school teachers on how to use music, dance, and drama in teaching and learning. I thank you very much. Next, we are going to have a documentary showing in images how the CPD development process took place. Thank you very much.
To use the methodology, the module, the unit, the activity that were developed in the Map at Home project to contextualize the mental health intervention in Rwanda. So Ananda already talked a little bit about Map at Home. Map at Home, it's a project which came during COVID pandemic, where there was a strict lockdown here in Rwanda, which coincided with genocide commemoration period here in Rwanda, a period which is, let me say, a mental health sensitive in Rwanda. So most all of us as mental health professionals, we were at home. Victims, survivors, community members, we were at home. And all of us, we were thinking what to do, how to do it, how to support people who were remembering, who were stressful with the COVID, who had fears, and the idea of using this approach of arts-based activity map came in, and we developed this project map at home by using arts, but specifically using the online methodology. That's why we developed the online curriculum, which has been used, if I can say, both physically, face to face, because if the situation allowed us to go to meet people physically, to train people physically, we organized those training, but also mainly we organized series of online workshop to people, to selected people who might have problem during that time. Those are survivors of genocide, young people who are former addicted to drugs, teen mom, and the other mental health for people who are usually uses mental health services from different health facilities, mainly in 5 districts from Rwanda. And later, this methodology has been included within the school system, where we piloted and we tested this online module, this online methodology to support young people, young students in 15 schools here in Kigali and Rwamagana in Eastern Province. So the CPD course, the CPD program came from this background and these processes. Let me first of all ask myself, what is CPD? A CPD, we talk a continuous professional development, but I would say those are training, those are learning, those are a kind of strengthening that are given to professionals just to be again energized, but to be again, if I can say, refreshed to increase personal and professional effectiveness in express. So why this CPD are specific for Rwanda, this mental health CPD? As I said, this came from the specific project Map at Home, but also it came from a specific mental health context in Rwanda. For mental health professionals, we all know we learned in external languages, English, French, and from Western, if I can say, expressions. But also we learned from Western developed theories. This, and sometimes they are sometimes different from the traditional culturally conception of what, how Rwandese conceived mental health problem, because Rwandese culturally they conceived mental health as something coming from outside, not from inside of people, something coming from evils, something coming from bad spirit, and also I will say that we as the mental health professionals, we have to intervene in Kinyarwanda, we have to intervene in the culture, using sometimes those Western concept, the Western perspectives, and then that was the main problem. And we have been inspired by this arts-based methodology to see how can we contextualize, how can we adapt the mental health perspectives, the theories to Rwandan context. Next, please. But in addition to that, background, we all know that in Rwanda, statistically, we have a high number of people suffering, high number of people having emotional, mental health problem. But also we have, if I can say, low number of people who are who access to mental health services. According to Rwandan National Mental Health Survey, they realized that even if many people, they know that mental health services are available, only 61% they contact those services, and only 5.3 they go to those services to seek support. So it was also a challenge. Next, please. So what was the process of developing this CPD? What was the process? The first process was to breed a framework, was to breed a partnerships, to breed a relationship between our methodology, our organization, with the institution that have in their responsibility to support, to train people. Next, please. So, and what those institutions? So we tried to first of all to see how can decentralize the idea to those institutions. And one of the institutions is the RBC, Rwanda Biomedical Center. Rwanda Biomedical Center is a national implementation body from Ministry of Health in Rwanda that is in charge of implementing and supporting all health-related programs in Rwanda, including mental health. So we had, first of all, to build a relationship and the partnership with that institution. And secondly, there is also another University of Rwanda, which is a higher education institution that provide accredited training to different professionals. So we had also to build that relationship mainly with mental health department, School of Medicine at University of Rwanda. And lastly, we had also the Rwanda Allied Health Professional Council. The Rwanda Allied Health Professional Council is in charge of, if I can say, accrediting mental health CPD programs. So that's why we started from there by signing MOUs, mainly from RBC, Rwanda Biomedical Center, and the University of Rwanda. And then we presented the CPD to the Rwanda Allied Health Professional Council to be accredited, to accredit the program, the CPD program. And And from that, the UNM, the Usenganimanzi, became a CPD provider in that course, and the course has been given 60 credit. Next, please. So I have already said what is Alabisi as an implementing agency. I have already said about University of Rwanda. You can next, please. Yes, I have already talked about the University of Rwanda and why we started. So what did we do and why? What is the objective of the course? So from the partnership, I talked a little bit above. We developed a CPD training course of 60 credit that has 30 credit of theory of training. It was a 1 week training, 5 days of all mental health professionals from 46 district hospitals and some lecturers from University of Rwanda, mental health department from School of Nursing, in the 30 credit of practice. As you know, mental health health services, it's not only theory, it's also practice. And after having those 60 credit, participants will be given an accredited certificate of being trained in that course. So we had 5 objectives. The first objective was to try to apply the culture and the arts-based skills in different mental health skills, such as emotional expression, active listening, as Ananda was saying. Because the module we developed a module with 5 units with different components. So we were to see how can we apply those developed culture and arts-based materials to mental health program. The second objective was to design and develop arts and cultural-based tool that can be used in mental health practices to explore the people psychosocial condition. So that was another objective. And the next objective was to acquire skills that allow the mental health professional to develop their resources and strengthen their coping mechanism and increase their self-esteem. And then it was to elaborate new approaches to people, to clients, to share their sensitive stories and to learn how effectively they can solve their problem through the digital, the online, and through the culture arts-based model. And it was also to improve the collaboration among different professionals as a multidisciplinary team for the purpose of helping, supporting people. Next, please. But also we wanted to reduce the risk of stigma. Stigma, you know, people with mental health problem, most of the time they are stigmatized, but by using arts-based and culturally appropriate ways, it should probably reduce the risk of being stigmatized. And it was the objective of promote people's psychosocial well-being through an innovative and integrated digital, cultural, and arts-based responsive practices. And to elaborate how Western mental health theories could be contextualized in Kinyarwanda language through the culture and the arts-based method. Those are the main objectives. Next, please. The methodology, as I said, the methodology was based on the module that we had developed during the Map at Home project. And we organized a 5 days training on different tools that we had developed for 46 mental health professionals, and people, mainly 2 people from RBC, Rwanda Biomedical Center, somebody who is in charge of clinical services, and somebody who is in charge of mental health services within the school system. So to be familiar with the methodology, but also people from University of Rwanda. Those are the people trained, but also we had people like social workers who had been involved in the methodology development, and the one master trainer who have been involved in the developing of the model. And all those tools have been tried to be linked to 2 theories that are the narrative therapy and the CBT cognitive behavior therapy, and to see how they can be practically adapted to different cultural arts-related tools. Next, please. Of course, after the training, after the 1-week training, it was also practicing for the 30 remaining credit. So the training itself was divided in 3 parts, in 3 steps. Of course, the session of teaching, of sharing the principles of those 2 theories, narrative and the CBT, and to be linked with, of course, the MAP methodology, the MAP at Home model that was developed, and then to see how all those 2 methodologies, 2 perspectives can be contextualized by using arts-based approaches. And then after practicing 38 arts-based tools that had been developed by BAM methodology, we had some practitioners, some professionals who have been involved in the MAP methodology to share their testimony, their stories, and we got also to patients to come to share, to tell us, to teach us how the MAP methodology helped them. Next, please. So, as a concluding, that was a course accredited by Rwanda Allied Health Professional Council, and that was the certificate given to the course, to the CPD provided, which approved 60 credit of training. Just to conclude, as I told you, we had we already signed the MOUs with University of Rwanda, with RBC. We became a CPD provider, and we are continuing to see how this methodology, this model, can continue to be used and to inspire us to continue to develop more CPD that can be used in the school system, that can be used in health facilities, and that can also be given to students and teachers, the lecturers, at University of Rwanda. We started that, and during the commemoration, the last commemoration period this year, we organized, if I can say, training with students from University of Rwanda, mental health department, clinical psychology department, to see how all those materials can be used to support. So I would like to thank you for your attention. Thank you very much.
And the colleague who is here with us, Dr. Jean-François Maniraho. Dr. Jean-François Maniraho is a lecturer and researcher at University of Rwanda College of Education. Over the last 14 years, Dr. Maniraho has been lecturing in different higher learning institutions, both inside and outside of Rwanda. He specialized in mathematics education with knowledge of teacher education. Based on his background with a Master of Applied Mathematics, he's also a data analyst with experience in MATLAB. Dr. Maniraho has published extensively in various peer-reviewed journals and has produced quite a good number of peer-reviewed articles. He's an associate member of African Center of Excellence for Innovative Teaching and Learning in Mathematics and Science, based at the University of Rwanda College of Education. Currently, he's leading the Department of Early Childhood and the Primary Department at the University of Rwanda College of Education. Welcome, Dr. Francois Maniraho.
Okay, thank you so much, Prof. I guess that you can hear me.
Yes, Francois, we can hear you.
Okay, thank you so much. First of all, let me start by thanking everyone who is present in this session, and I thank the organizer. And from that, I would like to really appreciate the work done by MAP, Mobile Arts for Peace, here in Rwanda, especially with us who are lecturing at the University of Rwanda College of Education.
The sound seemed to have
Yes.
lost.
Francois, we lost you. Can you hear us? Francois, are you still with us?
Yes, you don't know what happened. Maybe it was because they had started maybe recording. Sorry for the inconveniences. Yes, sorry for the inconveniences. As I was just saying, I was just trying to say that I appreciate the work done so far by MAP project in Rwanda, especially on the side of you as lecturers, because from like before the MAP project to start, it could not be easier to convince someone like people like
Francois, we lost you again.
I don't know what is happening. My internet is good, but sometimes I see that when you start recording, I lose everything. So I don't know. Maybe the organizer can check. Thank you. What I wanted to mean is that it was really not really convincing, easy to convince someone, especially like people who are coming from science and the mathematics background, where to tell like such people that mathematics or science can be taught using music, dance, and drama. It was tricky, but now with the introduction of map methodologies, we found that it's really workable, easy, and enjoyable. And frankly speaking, after developing the modules and some model lessons where people can teach mathematics and science using music, dance, and drama, we found that it is really feasible, enjoyable, and personally on my side as a math lecturer, we have even started using that map methodology in our daily teaching. Like if, for example, you want to introduce like sets of numbers, where we have the concept of sets in mathematics, we have started really integrating such kind of music, dance, and drama in our teachings, where, for example, if I want to introduce maybe a concept of sets, I can, for example, use the big wind blows game, and until to form, for example, groups, mingo, kind of, game, so that people can, group themselves. And then from that, I start maybe introducing what the concept of what a set is, how people are grouping, how people have been grouped, that those are just sets. You understand, those who may understand the content can just easily hear or the concept on what I wanted to map with. So we really appreciate the map methodology, and we as Prof said, we are maybe wishing, our wishes as like are that maybe this methodology, this map methodology, can be extended even to other levels. And I guess that with the partnership, as Prof said, with REB, with Rwanda Basic Education Board, that the dreams or our wishes may be a reality, because we have really seen that people are committed, especially Prof Silvestre on our part. We have seen that the commitment which they are having or is having by pushing this map methodology will be fruitful for the benefits of Rwandans, and especially for young generation, which is really coming, for the forthcoming teachers who will really replace maybe the existing one with time being. Thank you. That is what I can say for the 5 minutes which were given to me. Thank you, Ananda. Thank you, Prof.
Thank you, Dr. Jean-François Maniraho. Thank you. Ananda, over to you.
Thank you very much, Francois, for your reflections and endorsement of the CPD program. It's great to hear that that's been effective so far, and that you see it as a useful tool. I'm going to pass the floor over to Chast. Chast, if you could please introduce your respondent.
Thank you, Ananda. Clementina, can you hear me?
Yes.
Hello, Clementina, are you there? I don't know if Clementina has a technical problem, but the respondent is called Dr. Clementine. Dr. Clementine is the head of the mental health department at the University of Rwanda. She holds a PhD in social psychology, and she has been involved in the development of this CPD, and she She has been part of the training. She contributed and she participated. I think she has something to say. Clementina, can you hear us? Probably Clementine has a problem. Let me call her.
Clementine, are you able to unmute yourself? I believe you're muted right now.
I'm back.
Excellent, thank you. We heard you there for a moment. Are you able to unmute yourself, please?
Hello?
Great. Yes, we can hear you.
Yeah.
Turakumva Clementina, komeza.
Nabi.
Yeah, please proceed.
Okay. Kanazaire Clementine from URA, Mental Health Nursing Department. And I would like the people who developed this CPD program. It's very interesting, and it's also a pleasure to hear that there are people who started the journey of decolonize the knowledge and try to contextualize the mental health knowledge in our country, even in a Kinyarwanda language. I followed the presentation regarding the structure of the CPD curriculum or module, and is well designed. The participant or the learner are at the center of the teaching, and I was also I'm personally interested in how that dance, music, and drama can be used in teaching in high learning. Maybe our colleague from the College of Education can hear me the experience, and if they think it can be possible to use those kind of approach, such as dance, music, and drama in high learning institution. It can be even in specifically in mental health nursing. I think it can work, but you can share with us either the challenge you can meet and the way you can implement or use those kind of methodology in our teaching in mental health. I'm saying that because we have been trained by people from Uisengani Mansi, and I was amazed by the way that active listening is a unit, is a module. Of course, we teach in our department, and the way the people from Uisengani Mansi teach in a short period, the same concept, and in a easy manner where people can understand easily without also using those Western theory. The Western theory are considered but contextualized in a easy manner where someone can understand without spending a lot of time. That is my question regarding the people from the education campus. I think we have to think together how we can also decolonize the way we teach in it. Got to search together some approaches that can help us to friendly teach our students, even if our adults. I think those methods used in secondary school can be also adopted in high learning, but how? And I want also to emphasize on the presentation done by Shast, where he tried to show how that cohabitation between the cohabitation between that that perception, I can call it Rwandan perception of or conception of mental health problem or illness, and the Western one. Even in our department conducted research in Northern Province, Eastern and Southern, and we found that there is a dual perception of mental health. People on one side consider the mental illness is attributed to magic and supernatural causes. And on the other side also, they accept that there is the genetic or shock, substance use, or brain disease can cause a mental illness. Those kind of cohabitation related to the supernatural cause of mental health and that Western conception are still held by the Rwandan, and I think something has to be done in order to act as mental health professionals. We have to understand those kind of different conceptions when we are dealing, when we are trying to help our client, how to adapt, how to conciliate those different conceptions. And I think the map came as a response to this problem. And I would like to ask to people from Wisengani Manzi how MAP is a solution for that for that kind of cohabitation between that two conceptions among our potential clients. How MAP can be a solution to solve this kind of the stigma.
Thank you, Dr. Clementine.
How using that culture art-based model to mental health, yeah?
Thank you, Clementine.
And my last question. I have a last question. Can I continue?
Yes, go ahead.
Yeah, the last one is the CPD module has been developed and implemented also by Uisengani Manzi. After the implementation and based on your experience, do you think it's something that has to be adapted in this module or in this curriculum, because our field or community activity or experience has to inform also our curriculum? In that, I would like to know if there is something to, if everything is okay. Or it's okay after implementing it in on the field, and after using those different tools in helping your for thinking also of developing the partnership with the university. We think we have to prepare our mental health professional from the pre-service while they are in the university, and also to continue those kind of CPD when they are in service at the different health hospital or other organization that are in charge of helping people who suffer from mental health problem. Thank you for your good presentation, and thank you also for involving us as the university in that journey of decolonializing the knowledge and using our culture in contextualizing our tool in our module. Thank you. Thank you.
Thank you, Dr. Clementine. Ananda, can you go for the question, for the asked question?
Thank you very much, Clementine. So Clementine had presented a couple of different questions, and I also welcome our attendees, our audience, to ask questions and also post questions in the chat. Just a reminder as well to everyone that for anyone who wants to speak in Kinyarwanda, please do. There is a translation function. So on the bottom of your screen, you'll see a globe and you can click on English or Kinyarwanda. We do have interpreters with us today. If you would like to speak in Kinyarwanda, please feel free. So to go back to a couple of questions, there was a question about, so a question for Sylvester, about using dance, music, and drama in teaching and learning in higher education. Could you say a little bit about the challenge? And then for Chast, if you could maybe respond to the question from Clementine regarding decolonizing knowledge production and how that might best be integrated into higher education and teaching and learning as well. So first over to you, Sylvester, please.
Thank you very much, Ananda. Thanks, Dr. Clementine and Dr. Francois, for your kind remarks. Now, integrating the methodology of teaching and learning using music, dance, and drama in higher learning institutions is a good idea, but also I want to say it's doable. It's doable and it's even desirable in a context where there is a noticeable complaint towards our university graduates, especially when it comes to the mastery not only of the knowledge, but also of the skills required. which suggests that we have to rethink the methodologies we are using in teaching our university students. I would argue that the only challenge I would see is the number of students we have in our classrooms or in our lecture halls. But in a context where we have a manageable classroom size, I would say the methodology is feasible and doable. What is required is only to train concerned lecturers in the methodology or in the approach. The approach has an advantage of not only conveying a content which is expressed in locally available categories and tools, languages and symbols, but also in using locally available knowledges which can help to understand the knowledge you would like to communicate. As my colleague Francois has said, for instance, we are teaching mathematics. Do we have available knowledge in our culture, in our local forms, our local art forms that can help to convey that content in mathematics? For instance, can I teach geometry using guhamiriza? That's one example. In your case, mental health nursing, the exercise would be to say, looking at our content, we're looking at the content to be delivered to students. What content do we have already locally in our cultural forms that can be used to deliver that particular content? So here the methodology comes not only to serve as a vehicle of teaching and learning, but also as a way of informing the content to be delivered. The only caveat, as I said, being the big number of students in our lecture halls. I think we can follow up the discussion after this webinar, and happy to meet you, Clementine. We can have a discussion and see how we can extend the CPD beyond secondary schools to higher learning institutions. I thank you very much.
Thank you very much, Sylvester. Chast, do you want to respond to any of the questions posed by Clementine?
Thank you, first of all, Dr. Francois, Dr. Clementine, for the wonderful remarks and the contribution to this webinar. For the question asked by Clementine, the first question was related to how the methodology can be linked to Western theories that are being taught in schools, and how the methodology is reducing the stigma. Clementina we're together, and we saw when you are the even one who talked about when we were teaching the active listening, because in the methodology there is a unit called the active listening, which is the same unit which is in the program, the curriculum that you are teaching in the university, but sometimes we give it differently. That's what Professor Silvestre was saying, how the methodology, how the theory, how what we are teaching can we be taught by using our cultural way, our arts-based way to contextualize what we are teaching. And by giving so, it's the first way of contextualizing, of if I can say, dignifying our own ways, dignifying even our pain. By dignifying, it will be the way of, if I can say, reducing the stigma that are given by people to people who may have mental health problems, because we dignify, we demystify by using those cultural ways, by using those arts-based, we demystify what is mental health. The second question was about how this will be transferred to school, to curricula. I will say we already have a foundation. The methodology, as you know, Clementine, is now being used, is now being implemented, is being implemented by health facilities, almost in all district hospitals. We train them, and we have signed MOU with RBC, and the RBC Rwanda Biomedical Center allowed us to include the methodology in the approaches that are being used in the health facilities to support people. That's one of the foundation. We have already signed MOU with yourself, with the University of Rwanda, and now we still have to continue to research, to question what is being done in those health facilities, even in school with students, to see what the outcomes they are giving to people we support, and from that, and think together. It's not UNM, the MAP team, the University of Rwanda, yourself, the RBC. We will continue to adapt the MOD, the CPD to be included in the curriculum, as we said, as we wrote in the MOUs we signed. I think it's a good start, and I think later it will be something which will be included in the curriculum as we sign in our memorandum of understanding. That is what I can say to your question, Clementine.
Thank you very much, Chast. And now I'd just like to open up the floor. So just to ask if there's anyone who has any questions or comments. I will also stop recording so that people feel comfortable being able to ask questions and to engage in discussion.